And you can see that in pink color, what is depicted is the ventral division of anterior rami of the roots of sacral plexus. Okay, so this diagram, I think you can compare it with the diagram of the brachial plexus. Okay, so this is what the origin of the sacral plexus is with the nerve roots. Okay, the nerve roots are what emerges from the spinal cord. So here it's from the segments of spinal cord, that is from L4 all the way down up to the coccyx. Okay, this is the lumbosacral plexus. So let's look at the root value of sciatic nerve. Okay, this is a very wide root value, okay, from L4 all the way up to S4. So here to mention, it is from the anterior rami of L4 up to S4. Okay, so when you write in the exam, you write as L4, L5, S1, S2, and S3, S4. Now, when you look closely at this diagram, you can see this is the sciatic nerve, the large nerve, the sciatic nerve. But you look, it has two components. Okay, though it is one nerve, it has two components. So from its origin itself, the sciatic nerve has highly organized fibers. The common peroneal part or the common fibular part is the fibers are arranged more superficially, whereas the tibial part, the tibial component, is arranged as deeper fibers. Now, the tibial component of sciatic nerve consists of fibers from ventral division of anterior rami of L4 to S4. Okay, that is given in the pink color here in this diagram. Whereas the common peroneal part, the common peroneal component arises from the dorsal division of the anterior rami of L4 to S4. So keep that in mind. And yes, sciatic nerve, it is the largest branch of sacral plexus, lumbosacral plexus, and also it is the thickest nerve of the body. So can you tell me which is the longest cutaneous nerve of the body? Just a little refreshment of your memory. The sciatic nerve is the thickest nerve in the body. Some people also call it the largest nerve in the body. What about the longest cutaneous nerve in the body, which is also found in lower limb? Yes, very good. The saphenous nerve. The saphenous nerve is the longest cutaneous nerve in the body. Good. That is just a little revision question. The components, just remember the divisions, the tibial and common peroneal part. Now let's look at the course of the sciatic nerve. So I told you it's a very adventurous course, okay? So the sacral plexus is actually present in the pelvic cavity, anterior to psoas major muscle. So from the pelvis, the sciatic nerve leaves the pelvis and then enters into the gluteal region. It enters the gluteal region through greater sciatic foramen. And you all know that the sciatic nerve is seen in the gluteal region. It enters below the piriformis, and piriformis is the key muscle of the gluteal region. Then it is further course. It will pass between the two bony landmarks, if you can identify the greater trochanter and the ischial tuberosity. Sciatic nerve passes in between the two and then enters into posterior compartment of thigh. Okay, so you can see its detailed course. So if you know this in dissection and if you have an idea about this diagram, you don't have to learn all this by heart. Okay, you don't have to mug it up. If you can just remember this picture and how the sciatic nerve is entering into gluteal region and the thigh, you can describe it in your own words. These are a few of the key points that you can write about course of sciatic nerve. And the termination, also you can see here, termination is at superior angle of popliteal fossa where it divides into two terminal branches, the tibial nerve and the common peroneal nerve. So based on this diagram, can you tell me which nerve is more medial out of tibial and common peroneal? Which nerve will go medially and which will go laterally? This is how you will identify it in dissection. If you can type it in the chat. Yes, tibial nerve is medial and common peroneal nerve is lateral. So this is an easy way for you to just describe the course of sciatic nerve in brief. So even in your exam, it is not necessary for you to write a lot of paragraphs, but if you just write the headings and the important points with a good diagram, that will be enough, okay, to save your time. Now let's look at relations of the sciatic nerve. This diagram is given in your textbook and I want you all to learn it. Once you learn this diagram, you can describe the relations based on this diagram. So the anterior relations, okay? Now this is important for you to learn this key. This is the anterior aspect and the posterior aspect. So anterior relations of sciatic nerve is called the bed of sciatic nerve. So you can look at this picture and you can describe the anterior relations. It's very simple. From superior to inferior, the anterior relations are the ischial tuberosity and the dorsal surface of the ischium, the superior and inferior gemelli with obturator internus muscle, obturator internus tendon. Then comes the quadratus femoris muscle and the origin of the hamstring part of adductor magnus. So these structures from superior to inferior, they form the bed of sciatic nerve. It's the structures on which the sciatic nerve rests. So can you look at this diagram and just type in the chat what structure forms the posterior relation of sciatic nerve? You can see it in the diagram. Yes, posterior relation of sciatic nerve in yes, very good. It's the gluteus maximus muscle. So it's easy once you know the structures, even in dissection. What about medial relations of sciatic nerve? Just look at this diagram and can you tell me which nerve comes medial to sciatic nerve? And yes, just look at this, any nerve, any vessels which is medial to sciatic nerve in the gluteal region. You can type the answer. Yes, very good. The posterior cutaneous nerve of thigh is medial to the sciatic nerve. And this artery, can you name this artery? It is not labeled here. This artery which emerges from the lower border of piriformis muscle. Can anyone identify the artery? Which artery emerges into gluteal region from the lower border of piriformis muscle? We had learned that piriformis muscle is called the key region. Okay, yes, inferior gluteal artery. Okay. Now we look at relations in posterior compartment of thigh. In the thigh, the sciatic nerve travels in between the large muscle, which is the adductor magnus muscle, and this is the long head of biceps femoris. And you can see that this long head of biceps femoris crosses the sciatic nerve from medial to lateral side. Okay. So corresponding with this, as comparing with the upper limb, I want to ask you a question. In the upper limb, you had seen there is a nerve which crosses the brachial artery from lateral to medial side. So which nerve is it? In the arm, which crosses the brachial artery from lateral to medial side. Yes, it is the median nerve. Good. So I'm happy to see that you still have memory of the upper limb structures. That's good. Okay, so similarly, here the biceps femoris crosses sciatic nerve from medial to lateral side. And what is the nerve supply of long head of biceps? Nerve supply of long head of biceps. No, I meant biceps femoris, okay, in the lower limb. Nerve supply of long head of biceps femoris. Which component of sciatic nerve you have to mention? Okay. What about short head of biceps femoris? Okay. Yes. So the tibial component and the common peroneal component for the long head and the short head, respectively. Good. Now let's look at the branches of the sciatic nerve. It has cutaneous branches, muscular branches, and articular branches. So cutaneous branch, or the cutaneous distribution of sciatic nerve, is to the entire leg and foot, except two areas. Okay, there is an area supplied by saphenous nerve. If you look at this diagram, along the medial aspect of the leg and medial aspect of the foot, up to the ball of big toe, okay, is the cutaneous distribution of saphenous nerve. Which nerve does saphenous nerve originate from? Or saphenous nerve is a branch of which nerve? You can type it in the chat. Saphenous nerve is a branch of. Okay, when you say femoral nerve, you have to mention which division of femoral nerve. Is it anterior division or posterior division? That will be a more specific answer. Yes, posterior division of femoral nerve. Okay, so please keep in mind the area of distribution of the saphenous nerve. And also in the leg, in below knee, the posterior aspect, there is a small area supplied by the posterior cutaneous nerve of thigh extending into the leg. So sciatic nerves cutaneous supply will be actually below the knee, the entire area of leg and foot, except the area supplied by the saphenous nerve and the posterior femoral cutaneous nerve. Let's look at the muscular branches. Okay, the muscular branches are to the hamstring muscles. So now you have to tell me, hamstring muscles, what is the action of the hamstrings? Yes, does anyone want to volunteer to answer on the mic? You can tell me the action of the hamstring muscles. If you want to volunteer, you can raise your hand, or else I'll choose a person. Okay, Pooja, can you tell the answer? What is the action of the hamstring muscles? Yes, Pooja Krishna. Okay. Yes, Nikita. You can unmute your mic and give the answer.
Yeah, the muscle acts as a flexor of the knee and the extensor of the hip.
Okay, very good. And can you name the hamstring muscles as well?
The adductor magnus.
Okay.
And
okay. Anybody else? Okay. Good for answering the action of hamstrings. Yes, Nikita, that was very good because I think it's the first student who has answered on the mic. I am proud of that. Good. So can anyone else tell me the names of the hamstring muscles? Yes, Malavika.
Semitendinosus,
Okay, good. Any
long
other?
head of biceps femoris,
Yes,
then semimembranosus,
yes. And one more. Nikita
uh,
mentioned adductor magnus, but which part of adductor magnus?
ischial head.
Yes, very good. Good. So I'm happy to see. Yet again, the girls are leading. So I guess the next answer, the boys can answer. Okay. Yes, so the hamstrings, you all need to know, it's the flexor of the knee and extensor of the hip. And these are the names of the hamstring muscles that your friends have already mentioned. And it is the tibial part of sciatic nerve, which gives branches to the hamstring muscles. Now, if you look at this diagram, you can see the course of the sciatic nerve and the hamstring muscles taking origin from the ischial tuberosity. Look at its relation to the sciatic nerve in the thigh. The bulk of the hamstring muscles are medial to the sciatic nerve. So the medial side of sciatic nerve gives more number of branches to the hamstring muscles. Whereas from the lateral aspect of sciatic nerve, there is a branch which goes to the long head of biceps. So because of this fact, okay, that the medial aspect of sciatic nerve gives more numerous branches to the hamstrings, the medial aspect of sciatic nerve is called the dangerous zone, and the lateral aspect of sciatic nerve is called the safe zone. So even when you're a surgeon and you want to deal with the posterior compartment of thigh, you need to know the surface marking and the anatomical position of the sciatic nerve, and you need to take great care not to disturb the medial aspect of sciatic nerve, because the medial aspect gives the muscular branches more numerous. If there's any injury to sciatic nerve from the medial aspect, it can cause serious motor effects for the patient. Whereas the lateral aspect is a relatively safe zone. And the articular branch of sciatic nerve, as you know, it crosses the hip joint in the gluteal region. So it gives an articular branch to the hip joint. Now, surface marking of sciatic nerve. For the upper limb, when we are taking X-ray class for you, we have just mentioned you have to learn surface marking of certain topics in upper limb. The list will be shared with you a little later. Similarly, in lower limb, the surface marking of sciatic nerve is very important. So this is the correct diagram for that. I think in some textbooks, there's a slight variation, but this is the correct diagram, okay? So for marking the sciatic nerve on the skin, okay, surface marking means whatever structure is there deep in the body, we will be learning how to mark the position of that structure on the skin superficially. Okay, so for sciatic nerve surface marking, you need to feel the bony prominences, which is the ischial tuberosity, and the posterior superior iliac spine. Okay, here the labeling should be PSIS. Okay, posterior superior iliac spine and ischial tuberosity. You have to draw a straight vertical line connecting the two. Take the midpoint of that line, and our first point for marking sciatic nerve will be 2 centimeter lateral to the midpoint. Okay, this red dot is the first point, 2 centimeter lateral to the midpoint. The second point will be the midpoint of the line joining ischial tuberosity and the apex of greater trochanter. So you have to mark point 1 and 2 and connect both the points with a 2 centimeter wide band. Okay, you connect these 2 points with a curved line, which is 2 centimeters wide. That will be the surface marking of sciatic nerve in the gluteal region. For surface marking of sciatic nerve in the thigh, you have to take a third point at superior angle of popliteal fossa and join point 2 and 3. Okay, you can learn the surface marking from your textbook. It's a must-know topic for each of you. Okay, so now you can just type the answer. Very easy question. What is the level of termination of sciatic nerve? You already know. The level of termination of sciatic nerve, normal anatomy, at what level the sciatic nerve divide into its terminal branches? Yes, apex of popliteal fossa or superior angle of popliteal fossa. Okay, either apex or superior angle. Now there is a variant anatomy, which is a little common. It's just for your information. In some individuals, the sciatic nerve will have a high division. That is, it will divide into the tibial and the common peroneal part in the gluteal region itself. So in this individual, we can see this is the piriformis muscle, and this is the tibial nerve and the common peroneal nerve, the sciatic nerve dividing into 2 in the gluteal region itself. This is a variant anatomy. Now, in some people, the sciatic nerve will divide into 2 in the pelvis itself. In the intrapelvic course, the sciatic nerve divides into 2. So in such people, the common peroneal nerve can emerge into gluteal region above the piriformis muscle, and the tibial nerve enters the gluteal region below the piriformis muscle. In some people, the common peroneal nerve will also pierce the piriformis. So these are the variant anatomy which is present. Even if you don't know about the variant anatomy, it is okay. It is an extra question regarding high division of the sciatic nerve, but all of you have to know the normal anatomy, which is the termination of sciatic nerve at the superior angle of popliteal fossa. Now we look at the other nerves of the gluteal region. You have to learn its root value as well. So superior gluteal nerve emerges into gluteal region from superior border of piriformis. Root value is L4, L5, and S1. Now the nerve to quadratus femoris has a similar root value, same as superior gluteal nerve. Whereas the inferior gluteal nerve's root value is L5, S1, S2. You can compare the root value of superior and inferior gluteal nerve. And the nerve to obturator internus has the same root value as inferior gluteal nerve. Now we'll look at the posterior femoral cutaneous nerve, S1, S2, S3, which is medial to the sciatic nerve. Okay, before that, okay, so we had learned about intragluteal injection. Just tell me, superior gluteal nerve is present in which quadrant of the gluteal region? You can look at this diagram and just type in the chat. Superior gluteal nerve is present in which quadrant of the gluteal region? Yes, supromedial quadrant. So you need to keep in mind, supromedial quadrant of gluteal region, you have to be careful to preserve the superior gluteal nerve, whereas in the inframedial quadrant, be careful about the sciatic nerve and inferior gluteal nerve while giving intramuscular injection. Okay, so now next question for you to answer on the mic. Okay, we just named the different nerves in the gluteal region. So can anyone tell the muscles supplied by each of these nerves? Yes, I think Nikita has raised her hand again. Anyone else? Anyone among the boys? Or even girls is okay. Whoever's brave enough just to name the muscles supplied by each of these nerves. Yes, Lakshmi.
Ma'am, gluteus medius, gluteus
Yes.
minimus, and tensor fasciae lata.
Very good. Very good. What about the muscle supplied by inferior gluteal nerve?
Gluteus maximus.
Good, good. Very good, Lakshmi. Okay, now another person can answer. What is the muscle supplied by nerve to obturator internus? Yes, anyone else? This is a very easy question, I think. Anybody? Yes, Nidinem can answer.
It supplies obturator internus and gemellus superior.
Very good. Good. What about the nerve to quadratus femoris? It supplies which muscle?
It supplies
Yes, the
inferior
name
gemellus
itself.
and quadratus femoris.
Yes, very good. Good work, Nitin. Okay, so that's good. Now, next question, I would prefer if someone from table 1 answers. Okay, I know you're all very bright, so don't be afraid, but just be confident and answer. Okay, table 1. Yes, now we'll look at the posterior cutaneous nerve of thigh. Though the word is cutaneous nerve, okay, let's look at the course of posterior cutaneous nerve of thigh, which is also called posterior femoral cutaneous nerve. The root value is S1, S2, S3, and it is medial to the sciatic nerve. And this nerve, the special feature is that it is deep to the deep fascia of the thigh, up to the region of the popliteal fossa. Then in the popliteal fossa, the posterior cutaneous nerve of thigh will pierce the popliteal fascia, which forms the roof of popliteal fossa. And then it gives cutaneous branches in that region as well. So throughout its course, the branches that it gives to the skin of posterior aspect of thigh, all these branches actually arise deep to the deep fascia, and then they pierce the fascia to supply the skin. So this is just a little unique course of posterior cutaneous nerve of thigh. So even during dissection, it is after you reflect the fascia lata that you'll see this entire course of posterior cutaneous nerve of thigh. Finally, we come to vessels of the gluteal region. This is just to give you a broader picture. There is the artery called the common iliac artery arising from abdominal aorta. Okay, this is something you will see when you dissect the abdomen, the common iliac artery. In the pelvic cavity, the common iliac artery divides into external iliac and internal iliac arteries. So you can type this answer in the chat. External iliac artery continues as which artery in the thigh? External iliac artery, you can see it goes posterior to the inguinal ligament, yes, and continues as femoral artery in the femoral triangle. Good. External iliac artery continues as femoral artery. Good. Now look at the internal iliac artery. Internal iliac artery will divide into two divisions, an anterior division and a posterior division. So you need to know this to learn about arteries in the gluteal region. Okay. So in this diagram, this is a common iliac artery. This is the internal iliac artery. This is common iliac, internal iliac, and this is external iliac artery. Now, internal iliac artery is dividing into an anterior division and a posterior division. So please pay attention to this diagram. Okay, internal iliac artery dividing into anterior and posterior division. So from posterior division of the internal iliac artery, just look at this branch. This is the superior gluteal artery. So superior gluteal artery is arising from posterior division of internal iliac artery. Whereas in anterior division of internal iliac artery, just look, there are two branches here, the inferior gluteal artery and the internal pudendal artery. So internal pudendal artery, you remember, along with the pin structures, PIN, the pin structures which wind around the ischial spine. So this inferior gluteal and internal pudendal artery, they are branches of anterior division of internal iliac artery. You can remember that with the code AI, okay? Either the acronym for artificial intelligence or regarding the vowels, okay? AI meaning anterior division of internal iliac artery gives rise to these two branches which start with I, inferior gluteal artery and internal pudendal artery. Okay, so this is the diagram to show from superior border of piriformis arises the superior gluteal artery. From inferior border of piriformis emerges the inferior gluteal artery. And you need to know these are branches of which artery. Now, this is a higher level question. There is an artery here which accompanies the sciatic nerve. Okay, it's companion of sciatic nerve. There's an artery, a long branch here we see accompanying the sciatic nerve. So what is the name of that artery? It is a branch of which artery? You can see it in the diagram. The artery accompanying sciatic nerve is a branch of what? And what is the name of that artery? If anyone knows, you can type in the chat. Companion of sciatic artery, what is the branch? It's a branch of, okay, just compare in the diagram and find out. Good. It is a branch of inferior gluteal artery. So this is sometimes seen in dissection. A branch of inferior gluteal artery accompanies the course of sciatic nerve. And this artery has a very unique name. Okay, for those who are interested to learn, you can learn it as arteria nervi ischiadici. Okay, now this is of embryological importance because in the embryo for the lower limb, there is a long artery which supplies the entire lower limb, which is called the axis artery of lower limb. So this artery, the arteria nervi ischiadici, is actually a remnant of the axis artery of lower limb, the remnant which is found in adults. So this is just a higher level question. If you're interested, you can learn that. It is sometimes seen in dissection as well. Okay, now this is clinical anatomy. You already know it. We saw it in the last class. Sciatic nerve injury is most frequently injured by inadvertent injection in the gluteal region. So to avoid this injury of sciatic nerve, which quadrant of gluteal region will you give the injection? Yes, you can type that answer in the chat. In the gluteal region, which quadrant is chosen to give intramuscular injection? Good, the superolateral quadrant. And in superolateral quadrant, which muscle it is that you're piercing with the syringe? Which muscle is being pierced by the syringe in the superolateral quadrant? Gluteus medius muscle. Very good. Good. Okay, so this is just a picture to show you how to choose the superolateral quadrant. You will learn it in the clinics. You have to place the fingers in a V shape in relation to the posterior superior iliac spine and greater trochanter. And you can choose the superolateral quadrant. It's just a clinical procedure. Another cause of sciatic nerve injury Also in road traffic accidents, if there is posterior dislocation of the hip. Okay, so during road traffic accident, if the knee is getting an impact from anteriorly, this force will be directed up to the hip joint and it will cause posterior dislocation of the hip, which will cause injury to the sciatic nerve and the gluteal region. Now, if sciatic nerve is injured in the gluteal region, it has a widespread motor and sensory effect. So, as safety while traveling, apart from wearing the seat belt and having a vehicle with airbags, when you're traveling in the front seat, also make sure that your knee should not be in close contact with the glove compartment in front of you. Okay, there should be some gap. So don't sit cross-legged even while traveling in the front seat. Okay, because in case of any RTA, if there's a road traffic accident, the impact will be easily transferred from the knee up to the hip. So what are the effects of sciatic nerve injury? The motor effect, you can see, okay, because of paralysis of muscles, there will be wasting of muscles below the knee. So now sciatic nerve, you all know it divides into tibial and common peroneal nerve. In the thigh, the tibial component supplies the hamstring muscles, whereas the common peroneal nerve supplies the muscles below the knee. You will be learning it in the compartments of the leg. So when sciatic nerve is injured in the gluteal region, the muscles of the leg, which is below knee, will also be affected. So here you can see in the left lower limb, there is wasting of muscles marked with the arrow when you compare it with the healthy limb. Now this is just an extra point. The movements which are intact for the patient will be, there'll be a weak flexion of the knee, which is possible because sartorius and gracilis are intact. And a weak extension of the hip is possible because gluteus maximus muscle is intact. Now, this is just a movement you can demonstrate in your own foot. Okay, when you raise the foot up off the ground, okay, from anatomical position, it is called dorsiflexion. Whereas when you plant your foot on the ground, like when you stand on your toes, that is called plantar flexion. So in people with the sciatic nerve injury, all the muscles below the knee are paralyzed. So gravity and the weight of the foot will cause it to assume a plantar flexed position or foot drop. Now this will be more markedly seen when the patient tries to raise his lower limb off the ground. The foot will be plantar flexed. And there will be when the patient walks, the foot will be slapping on the ground because it's plantar flexed. This is called stamping gait. So these are all just some extra points, but all of you just need to know there'll be wasting of muscles and foot drop is important. Whereas the sensory loss, you already know, the sciatic nerve supplies the full lower limb below the knee, except the area supplied by the saphenous nerve, that is the medial aspect of the leg, and up to the ball of the big toe in the foot. So later you can learn this diagram, which is cutaneous innervation of the sole of the foot, just like you had learned cutaneous innervation of the palm and the dorsum of the hand. For upper limb, you have to learn cutaneous innervation of the sole and the dorsum of foot. You can learn that after next week. Okay, so this is just a summary of effect of sciatic nerve injury in the gluteal region. Because of paralysis of hamstrings, flexion of knee, extension of hip is affected, paralysis of all the muscles of the leg and foot. So all the movements of leg and foot are affected, and sensory effect. The area supplied by the saphenous nerve will be intact. There'll be loss of sensation elsewhere. These are effects of sciatic nerve injury in the gluteal region. Effect of sciatic nerve injury lower down, which involves the tibial and common peroneal nerve, you will learn later, along with the compartments of the leg, because you need to know the cause of those nerves separately. But for your exam, if this is asked as a long essay question, you can mention even the effect of injury lower down. Okay, right now, I'm only teaching you effect of injury in gluteal region because you only know the cause up to here. Another clinical aspect is something called sciatica. I think some of you would have heard of this. Okay, suppose the intervertebral disc, okay, the cartilaginous disc, which is present in between the two vertebrae, the intervertebral disc, if it has a bulge, okay, this is called intervertebral disc prolapse. It can affect or compress the root of the sciatic nerve. Okay, so the roots of sciatic nerve, if it gets compressed, there will be pain that the patient experiences along the entire course of sciatic nerve. This is because the root itself is getting compressed, so all the fibers of sciatic nerve is affected. So there will be pain throughout the course of sciatic nerve. So the pain will have pain in gluteal region, and the pain will be radiating to the back of thigh and the leg. This is called sciatica. Okay, so that's all for today's class. Now, this is just a small revision of the structures. So will anyone volunteer to name the structures labeled 3, 4, and 5? Now, structure 3 is marked in gluteal region and in popliteal fossa as well. So is anyone brave enough to just name these structures? You can raise your hand. Yes, anyone? Apart from Lakshmi, is there anyone? Okay, otherwise you can just type it in the chat then. Can you name which structure is labeled as 3 in the gluteal region? You can type the answer. What is the structure labeled as 3 here? Yes, sciatic nerve. Yes, you all know that. What about the structure labeled 3 here in the popliteal fossa? Okay, you just have to observe, look closely to see the sciatic nerve dividing into 2. One branch will go medially, one will go laterally. Yes, so in the popliteal fossa, this is the tibial nerve. If you look carefully, you can see the common peroneal nerve going laterally here. This is the tibial nerve. What about this muscle labeled as 4 first? The muscle labeled as 4, it forms the superomedial boundary of popliteal fossa. So what is that muscle? And it's having a long tendon here. That's another clue. Semitendinosus. Good. What about this muscle labeled as 5? The muscle labeled as 5 would be, it's forming the supralateral boundary. Yes, you're correct, class. It's the biceps femoris, long head. Now, can anyone volunteer just to name these structures? If you can unmute your mic and give the answer. Yes, class. If any of you answers this question, just have to tell me what are these structures labeled 1 to 5. If you volunteer to answer for this, you will get a small prize when you come back for your offline class. Okay, so if anyone is brave enough, you can just raise your hand and volunteer. I'll give you a minute. If not all the structures, at least a few of the structures. I know you guys are smart enough to actually identify this. That's why I'm asking you. Okay. Yes. Yes, Bitty can answer. Very good. Yes.
Pyriformis.
Yes. 1 is piriformis. Okay. What about 2? The nerve arising from lower border of piriformis.
Inferior gluteal nerve.
Yes. Good. What about 3? The medial most structure. These are the structures which wind around the ischial spine. So what would that nerve be?
There's a variant, right, ma'am?
No. Okay, so
No.
this is actually the pin structures medially. Yes. So in pin structures, what does P stand for? Anyone knows? Okay, you can skip that. That is pudendal nerve. Yes, pudendal nerve. Yes. Now, can you name the structure labeled as 5? The thick nerve there.
Sciatic nerve.
Yes, that is sciatic nerve. What about labeled as 4? That will be the nerve medial to sciatic nerve.
Cutaneous nerve of thigh.
Yes, very good. Very good, Bitty. Well done. Good. So Bitty has honored table 1. Okay. Okay, so it's because now this is a topic that I've been teaching for a while now. So yes, so this proves that you guys are reading a bit. Okay, so that's because I think some students have told me they're finding it a bit difficult to start